Have you ever felt a lump under your skin and wondered, what is this? Could it be cancerous? The truth is, most of the time, these lumps are not cancerous. The two most common causes are cysts and lipomas. At first glance, they may actually look alike, but they are made of very different substances and they behave in very different ways. In this video today, we'll go step by step what cysts and lipomas really are, how you can tell them apart, how they're treated, and when a lump is more concerning, what to do about it. But first, welcome back. I'm Dr. Marie Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So let's start with cysts. What exactly is inside them? A cyst is a firm lump just beneath the skin. Inside, it's filled with keratin. Keratin is the protein that makes up your hair, nails, and the outer layer of your skin. But when it collects inside a cyst, it turns into thick, whitish material that often looks like cottage cheese or toothpaste, and yes, it can smell pretty bad when released. Cysts form when a hair follicle or oil gland becomes blocked, and they're especially common on the face, neck, chest, especially on the back. A classic clue is the tiny pore or a black dot that you may see on the surface. It's almost like a small doorway into the cyst. Most cysts don't cause problems, but if they rupture or get infected, of course, then they would swell, turn red, become painful, and sometimes drain that keratin material along with the pus. Now let's look at lipomas because they are completely different. A lipoma is made up of fat cells, so instead of being spread out under the skin, the fat clumps together into this fatty, dense lump. So when you touch a lipoma, it feels soft, squishy, and rubbery, almost like pressing on a marshmallow or a bowl of dough. And you can usually move it a little under the skin. So lipomas don't have a pore or a surface opening, and the skin above them looks pretty normal. They grow slowly, they're usually painless, and they don't get red, or very rarely would they get inflamed. Many people live with them for years without needing any treatment. So let's summarize the differences between cysts and lipomas because this is what we look for when we examine patients. So first criterion is contents. A cyst contains keratin, that thick, again, cottage cheese-like material, while lipoma is simply made of fat. The next criterion is texture. A cyst feels firm and tense, almost solid under your fingers, and lipoma feels soft, squishy, and rubbery, completely different. The next criteria are surface clues. Cysts often show a pore or a black dot, which is usually located at the center of the cyst on its surface. Lipomas don't have that. The skin looks completely unchanged, skin colored. Next criteria are symptoms. Cysts can swell, hurt, and sometimes drain, while lipomas stay calm, painless, and quiet. The next one is location. Cysts sit just under the skin surface, and lipomas are a little bit deeper in the fatty layer, which is why they sometimes feel like they roll around when you press on them. So the quick way to remember: cyst, firm mass that gets irritated. Lipoma is a soft lump that usually stays calm. So, but what happens if you want to have it removed? Well, for both the cyst and lipomas, I surgically remove them, especially if they are larger or become symptomatic. For example, they're painful, itchy, or just plain uncomfortable. With cysts, I do have to say that sometimes cysts may shrink or they stay stable, but many just don't go away permanently. So the most reliable fix is a surgical removal, including the cystic wall, because you have to remove that envelope, that cystic wall that contains the keratin. If the cyst is infected, we may need to drain it first and sometimes prescribe antibiotics, and I have a video about that, which I will pin. And then the elective excision of the cyst may happen a few months later, sometimes years later. It depends on when that cyst comes back. With lipomas, again, they're usually stable in size. They don't get infected, but we do electively remove them if the patient is interested in having it done so, and especially if they're bothersome and sometimes for cosmetic reasons. Sometimes they're cosmetic removal because they're just unsightly. So now, here's the most important part of this video. When should you be concerned about a lump? Not every lump is a cyst or a lipoma. There are rare cases where solid lumps can actually be sarcomas. Those are cancers of the soft tissue, and fatty lumps can occasionally be liposarcomas, which look like lipomas, but they are cancers. They are malignant. Both are very rare, but they can mimic harmless lumps. So when should a lump be evaluated? Of course, number one situation, a new lump should always be checked. That's a very clear indication. Next, a lump that is symptomatic, meaning now it's painful, itchy, or even if it has new symptoms like tingling or burning sensation, it should be checked out. A lump that is growing, that should definitely be evaluated. A physical exam means a lot, and very often I add imaging, especially for a new lump, such as an ultrasound, to get more detail and make sure that nothing serious is being missed. If it is a cancerous mass, then a completely different cancer algorithm kicks in. So here's the takeaway. Cysts and lipomas are two most common causes of lumps under the skin. A cyst is a firm mass filled with keratin that can sometimes get irritated or get infected, and lipoma is a soft lump of fat that usually stays painless and quiet. And most of the time, these are harmless, but the safest choice is to let your doctor evaluate any new or changing lumps. And that way you will have clarity, peace of mind, and if needed, the right treatment. If you enjoyed this video, please like, share, subscribe. I'm looking forward to reading your comments. Thank you so much. Bye-bye.